As you know, we don't start businesses very often in the group. Probably we haven't started one for a few decades now. And we want to do all of our businesses very carefully and mindfully. And in a similar way, when we start a business, there has to be an availability of a family member to oversee it, to lead it, and to drive it. So that is why it doesn't happen very often. It took a while to actually convince the family council, but given the industry that we chose and why we chose it and how we're going to build it, I think it was compelling to them. But again, there's always the conservative approach. But I think that I got full support from the family. The group is fully invested in this, and we're looking forward to building out a new venture in the group. Luckily, we also have a level of autonomy when we're building this out. So we can build it the way we want, how we want, as long as it is perfectly aligned to our group's values. And for us, that's what binds us. The business doesn't necessarily bind us, it's the values that binds us. We're starting our healthcare system in Pune. Hopefully we will get to other cities once we stabilize. We're building a full integrated model and an ecosystem. So for that, there are various touch points, which include clinics, ambulatory day surgery centers, a hospital, home care. For this, we need obviously a set of clinicians. We need clinical, non-clinical. I think talent in India is abundant. It's about tapping into the emotion of people, tapping into, because we're a purpose-driven organization. So we have to tap into that. We have to attract the people who are driven by the same purpose as us. And of course, I believe that with 1.5 billion Indians, our clinicians are probably the best in the world. Doctors, nurses, technicians. We have the best in the world, and that's why they're in such high demand globally. It is a bit of a challenge because they have higher opportunities outside of India, but we want to try and build a culture, an organization that actually makes it attractive for them to stay in India or even come back to India, to drive and deliver a healthcare system in India that hopefully will change the way healthcare is delivered and received in the country. Over the next 6 months, we should launch our clinics and our ambulatory center. Our hospital will come live in 3 to 4 years from now. We're doing it entirely greenfield, so it's purely the time of construction, time of setting it up. But we will have clinics and ambulatory centers up and running in the next 6 months in Pune. Next year, depending on how the market is receiving it, we will add some more clinics and ambulatory centers across the city so that each person has access to all 3 formats of our healthcare system, of clinics, ambulatory, and hospital. Home care, of course, cuts across the entire city. So that's how we're building it out. Once we stabilize Pune, we believe that Mumbai is our next market. Beyond that, it's too early to say, and we will take that call at the right time. While the traditional way to, let's say, calculate the scale of a healthcare venture is the number of beds or the average revenue per operating bed, for us, we're actually attempting to push people away from the hospital to give them treatment at the right venue based on the acuity of their needs. So it's not necessarily about making the maximum number of beds, because we believe that most interventions actually don't require a hospital. So if we can treat people in a lower acuity setting, that is, of course, there's no question on quality and safety. That is something that is paramount. Why would we treat them in a hospital, and why would we try to build more beds? Having said that, of course, we will have the appropriate number of beds for each city so that we can take care of any tertiary and quaternary intervention that's required. So, for example, in Pune, we will have somewhere between a 450 to 500 bed hospital, and maybe that's a similar format to other cities, but again, it will depend city to city. At the moment, we are looking to build this out organically. we believe that it is a completely different model than what exists in the country, which means for us that has to be greenfield. There's no question on that. Nothing wrong with an inorganic play, but at the moment we believe that organic is the way to go. The investment, I believe in Pune, we're expected to spend about 2,000 to 2,500 crores capex. Maybe it's a similar format for different cities, but the economics in each city vary. So difficult to say at the moment. But what I can say is that we will hopefully be across about 7 to 8 cities in the next 10 to 12 years. Hopefully our format works well with is accepted by the Indian population, because genuinely we believe that in our method the only winner is the Indian population, because we want to treat you from prevention to acute intervention and move you away from the hospital as much as possible, which is lower acuity, lower infection, and probably a little bit easier on the pocket.
We started with our grandfather, Jamnalal Bajaj, who Gandhi considered his fifth son. So his focus, of course, that time freedom struggle, and he was a philanthropist and a real patriot. So we're lucky to have that kind of a legacy. And then slowly, as India got independence, it was also a question of India's economic development. And that's how the Bajaj Group started its, and as you say, it is quite diversified. Of course, for us, Bajaj Auto, the most valuable two-wheeler, three-wheeler company in the world, and Bajaj Finance. So very, very fortunate, very lucky that we are a conservative group, never into the rat race of numbers, but yes, pushed for excellence, pushed for trying to create world-class companies, and I think we have been fortunate to come a long way. The focus, a lot of changes have taken place, but the one thing which has remained constant is I believe, the ethics, the values, the principles, the integrity which was taught by our elders, and we try to live up to it. The trust in the Bajaj name, very, very precious for us, and we have to be, it's a huge responsibility. So we try to, times have changed, things have changed, but yes, we are inspired by our elders, and that is how we've gone. Different businesses, of course, as I was mentioning, even Bajaj Finance is number one NBFC in the country. So many other companies which have come up, some big, some small, but touch wood, all we have tried to really push for excellence and try to improve every day we go to work. It is to improve our organization, something, and also focus somehow on the middle class, on the lower middle class. How can we improve their lives, and really try to do things which our country can be proud of.
Well, I've been working with Bajaj Finserv for the last 5 years, ever since I graduated my undergrad. And I'm currently working with Bajaj Alts, which is the new investing business that we've set up last year. And the reason was very simple. The family's been doing this for 100 years. They've done so much in so many different sectors, and there's no need to join somewhere else when I have this legacy that I can take forward. So it was a very easy decision, although it was one that was never forced. My dada always said, just do what you want as long as it makes you happy and that you put in your effort to that. But it was an easy decision to continue with the group.
So now we are moving towards a very good rapid fire round.
Okay.
So to a Gen Z, Are you a khadi or a high street fashion? What would you choose?
Khadi is part of our roots, and whenever we go back to Wardha, we stick to it. That's where we buy khadi from. I've had the opportunity to go see where the weavers weave the fabric as well. But you have to keep up with the times as well. So in our day-to-day lives, we do wear high street clothing. It's not possible to just wear khadi. But we do have pieces to signify the value that it brings to our family.
And one more, cherished values or the bottom lines?
Always values. My dada said, values come first, profit will always follow, but you can't change the values that the family has had.
You talked about the values. I think it's a difficult question. Who is your mentor in your family?
I think over time, this interview you must have realized, but it's my dada. I grew up with him, and even though he passed away 4 years ago now, his teachings and everything that he said to us remains with me every single day.
Outside of business part, what are your personal interests?
I really enjoy baking and cooking, which is a much appreciated hobby in a family like ours that is full of foodies.
So I just joined the group last July officially. Before that was internships. I've joined as our managing director Rajiv Jain, one of his executive assistants, as a training role. So I'd spend a year in this role, and in the coming months I'd move into a more operating position. The brand Bajaj represents for me a brand and a family name that has a lot of legacy, following good ethics, building good, sustainable, long-term businesses for not only our customers but also our shareholders, and it's always customer first for us.
So now jumping to the rapid fire round, khadi or a high street fashion, and why?
Definitely a combination of both. We come from strong roots in Wardha, and as my sister said to you earlier, we wear khadi when we go to Wardha. We do have pieces for certain events, but I think in a day-to-day life we are all moving to high street, but we're never forgetting khadi.
Okay, one more, cherished values or bottom lines?
I think cherished values always. My grandfather always told me that we start with ethics, we build good ethical businesses, bottom line will follow. We build for the country, not for profits.
Okay, I guess it will be difficult to answer. Who is your mentor in your family?
I think everyone. I have a lot of people that I can look up to, but my grandfather definitely is someone who I've looked up to, who I have followed, taken a lot of advice from, and I still look up to him. I read a lot about him whenever I feel that there is something that I would have to go to him for.
Okay, and one last question, outside of business, what are your personal interests?
I really enjoy playing sports and going to the gym, so I make it a point every day after work I'm either playing a sport or I'm in the gym for an hour.